Welcome to Myth vs. Medicine, where we separate science from speculation. In this episode, we'll explore what endometriosis is, how it impacts fertility, and the options available for those seeking to build a family. Let's dive in. Endometriosis occurs when tissue similar to the lining of the uterus grows outside the uterus. This tissue can attach to the ovaries, fallopian tubes, pelvic lining, and sometimes even organs beyond the reproductive system. Each month, just like the endometrium, this tissue responds to hormonal changes. But because it is outside the uterus, it has no way to exit the body, leading to inflammation, scarring, and pain. Symptoms vary widely, but the most common include severe menstrual cramps, chronic pelvic pain, pain during intercourse, heavy bleeding, and fatigue. Some women also experience digestive issues, bloating, or urinary pain. While diagnosis is often delayed, many women wait for several years before receiving confirmation, partly because symptoms overlap with other conditions. Imaging tests like ultrasound or MRI can help, but the gold standard remains laparoscopy, which is a minimally invasive surgery that allows doctors to see and sometimes treat lesions directly. This delay in diagnosis doesn't just prolong suffering, it can complicate fertility planning. Because by the time endometriosis is identified, scarring or damage may have already occurred. Now, let's focus on fertility. Endometriosis does not automatically mean infertility. Actually, many women conceive naturally, but statistically, 30 to 50% of women with endometriosis face difficulties due to the following reasons. Firstly, adhesions and scar tissues can distort reproductive anatomy, making it harder for eggs to travel through the fallopian tube. Secondly, chronic inflammation can impair egg quality, reduce sperm function, and interfere with embryo implantation. On the other hand, hormonal imbalances may disrupt ovulation, while immune system dysfunction can make the uterine environment less welcoming to embryos. By the way, treatment depends on the individual goals. For pain management, hormonal therapies and pain relievers are common, but when fertility is the priority, the approach shifts. Other options include laparoscopy to remove lesions and restore anatomy if fertility is not a concern. Clinicians may also recommend assisted reproductive technologies, intrauterine insemination, or in vitro fertilization, which has helped many women achieve pregnancy. Endometriosis can bring frustration, anxiety, and even depression. The journey to parenthood may feel overwhelming. That's why emotional support is vital. Counseling, support groups, and open conversations with loved ones can make a profound difference. While a balanced diet, regular physical exercise, and stress management can improve overall well-being and may help support fertility outcomes. In conclusion, endometriosis is more than just a medical condition. It's a journey that affects the body, mind, and future dreams of parenthood. While it can create challenges for fertility, it does not define the possibility of becoming a parent. With awareness, medical support, and resilience, many women proceed to conceive naturally or with assistance. Thanks for joining this deep dive into endometriosis and fertility. My name is Skylar. If you found this video helpful, subscribe for more women's health education, fertility insights, and medical awareness content. Share this video with friends, family, or anyone who could benefit from it. Remember, you are not alone. And if you are experiencing symptoms related to endometriosis or any other medical conditions, please seek care immediately.